Hi, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I would like to provide you with updated information regarding COVID-19. The number of confirmed cases of COVID-19 in the nation continues to grow. In North Carolina, there are 412 reported cases in 48 counties. We have not had any individuals test positive for COVID-19 in Dare County. When we do have a positive result, we will share that information as soon as possible. I want to start today with an important message for all of us. This message is a plea for compassion and kindness. We truly are all in this together. There is no place for hate, ill will, or labeling. Social media can be a useful tool for communication, but it can also be a platform for divisive and negative behavior. I encourage everyone to commit to using social media to spread facts and information of support and care. The Outer Banks is such a special place because of our people. Regardless of where you live, what car you drive, or what language you speak, it is important to treat others with kindness and respect. When we feel love and kindness toward others, it not only makes others feel loved and cared for, but it helps us also to develop inner happiness and peace. And inner happiness and peace is something we all can use these days. I would like now to introduce Ronnie Sloane to share an update from the Outer Banks Hospital.
First, I want to thank our local public health and county officials. Since day one of the COVID-19 outbreak, we have pulled together to protect the public's health, your health, and the health of your loved ones. This is important because public health is all about surveillance and prevention. Most of the work of public health goes unnoticed because this work generally takes place behind the scenes to prevent things from happening. In partnership with national, state, and local public health officials, the very best outcome of this crisis is we may prevent widespread outbreak that cripples our regional and local healthcare system. I don't consider myself a public health official, but as a president of the Outer Banks Hospital and Medical Group, I am honored to work alongside Dr. Sheila Davies and staff. What most people don't know about me is that I'm also a respiratory therapist. In my career, I have managed many patients who needed ventilator or respirator assistance to breathe. I've also weaned patients off of ventilators who no longer needed it to breathe and went on to have a full recovery. I've also had to discontinue ventilator support when even the best medical efforts were not enough to save someone's life. It's both rewarding and at times heartbreaking to be on the front lines of critical care. Here at the Outer Banks Hospital, we are preparing to care for patients in our community who need medical care due to COVID-19. It is normal for some people to be anxious and have questions about our local ability to care for patients. I read some of what is posted on social media, and I am empathetic to the concerns being voiced. The uncertainty out there is overwhelming. The when and what ifs are piling up. When will schools reopen? When can I go back to work? What if I get sick and need medical care? These are very real and burning questions of the day. I hear you and I understand your concern. What I can tell you about local medical care from the front lines is that we are actively preparing in the event that a patient presents with COVID-19 symptoms and requires medical attention. Ventilator care is something that we provide routinely in our emergency department as we care for patients who have had a major cardiac event or traumatic injury and are awaiting transfer. We also ventilate patients during surgery cases. We are in our second week now of planning for a potential surge of patients who need care. This work includes securing and preserving resources we may need. Although we don't have an ICU, we have critical care training team members who can run an ICU-like environment. It is important to note that we will most likely stabilize and transport most patients to a nearby facility. We have been coordinating this with our partners at Vidant Health, Chesapeake Regional Healthcare, and Centera. Please understand that I cannot give you an exact count of medical supplies, including ventilators that we have on hand. The tally of resource changes daily based on regional stockpile availability and where the resources are needed the most. What I can tell you to help put your mind at ease is that we have ventilators and we can stabilize patients and provide supportive care here at the Outer Banks Hospital. I think it's also fair to say that this crisis has been challenging for even the biggest, most resourced hospitals and healthcare systems in our country. Even the largest hospitals in the country are being stretched as they handle a surge of sick patients. A large surge of local patients would challenge us here locally as well. I know you keep hearing it, let me emphasize it again. The most important thing you can do right now is to practice and promote social distancing. We are all trying to prevent a large surge of sick patients through slowing down the spread of the virus, to slow down the curve in order to ease the strain on our healthcare systems. Thank you for doing your part. It is making a difference, and we will get through this together.
Thank you, Ronnie. And a special thank you to all of those working on the front lines to help our community during these trying times. From doctors, nurses, and other medical personnel, law enforcement, EMS, firefighters, grocery store and gas station personnel, childcare workers, county and town staff, and all of the many others who are still providing key services and programs. A special thank you to all of you who are working every day for all of us. As we move forward through this pandemic together, facts over fear is the best way we can all find comfort. We will continue to provide updates with factual information as we receive it, and we encourage you to stay informed by visiting www.darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have special needs or questions, you may also call the Dare County COVID-19 Call Center at 252-475-5008. Thank you.